and governments must ensure that children survive and develop in the best possible way. However, every year, nearly 45% of all children under the age of 5 die during the neonatal period. In Western Uganda, a refugee-based health facility is helping save the infants through skilled care after birth. Godfrey Badabie reports from Kampala.
In developing countries, access to healthcare is low. Most newborns die at home without skilled care, and this is greatly increasing their survival chances. In sub-Saharan Africa, the neonatal mortality rate is estimated at 27 and 24 deaths per 1,000 live births in 2020.
For children that are born before their time, the biggest challenge that they usually have is a challenge to breathe, because their lungs are usually not mature enough like the lungs of children that are born at their right time. So most of the support we give in the early days is to help them breathe. We are able to give them oxygen here, and we are even able to give a more advanced form of oxygen that we call a CPAP, where the oxygen is pressured to help open the airways into their lungs. This all goes with the routine care that we usually give young children. We make sure they have a source of glucose that they get, and we also put them on antibiotics to either treat or prevent their risk of catching infections while we manage them.
Preterm birth, low birth weight, neonatal diseases are a great cause of high infant mortality rates. Vumilia Chantel was close to losing her newborn baby 4 months ago due to low birth weight.
I gave her medicine, and they also gave her medication. I couldn't do anything but pumped breast milk and gave it to the baby, and she has grown.
Ramanja Refugee Settlement Neonatal Intensive Care Unit is helping mothers like Vumilia give life to their premature babies. This is through the skilled health workers and well-equipped facilities.
We receive the babies who are 1.2 kilograms. We manage them. At the end of it all, we find the babies have gained weight, they're active, and the mothers are so happy.
So we're able to set up an 8-bed neonatal unit that has so far served 300 babies. A good number of these babies are babies that are born premature. That means they are born before the time they should be. And the other two categories of babies that we've been able to manage here are babies that when they are born, they are realized to be carrying or having an infection, and also babies that do not cry immediately after birth. So with these three categories of babies, we've been able to save a great chunk of them.
United Nations Population Fund, as a sexual and reproductive health agency, has for the past 1 year stretched its helping arm to the refugees in Ramanja settlement camp to a safe healthcare. They have reached close to 40,000 refugees and host community members.
Included primarily the continuation of essential sexual and reproductive health services, particularly strengthening referral pathways for pregnant women through the procurement and provision of 2 ambulances for Lamuo and Kamwenge. In addition, the strengthening of capacities of health facilities by providing essential medical equipment and items like reproductive health kits to cater for the sexual reproductive health needs of these communities. And finally, strengthening the capacity of health service providers themselves, targeting midwives in particular by supporting, hiring, and training these midwives to serve the needs of pregnant women and young mothers.
And the different implementing partners like the government and the Japanese government are attesting to the great boost in the healthcare and increasing availability and utilization of health and rights.
The death reduced significantly, and these days we don't get a lot of maternal deaths. I don't know what has happened because of the capacity buildings and the mothers being monitored properly, and then the resuscitation. you know, those skills being imparted to our server. So the maternal and newborn care, I can clearly say it has reduced.
Delivering life-saving sexual reproductive health and rights has outrightly been achieved, but quite a bother is the sustainability of these facilities when funded through programs like this one come to an end.
We do feel that maybe in some areas the districts could take over, but certainly more partner and donor support is required, and we will continue working with all our partners to ensure really that these services do continue and are not disrupted. So yes, while one year may appear short, I think for when we look at life-saving interventions in an emergency context, I think the important thing really is to ensure that we are able to cater for the immediate needs, but not necessarily the long-term needs of these communities.
The realization of reproductive rights for all is a conversation that should be supported across the globe in supporting reliable access.
Indeed.